Hey there, my name is Andy Hollowell. I'm a licensed clinical therapist, and I hope you find this video helpful.
What is dissociative identity disorder? Dissociative identity disorder, or DID, is a disorder that was previously known as multiple personality disorder. It involves a person developing several separate personalities or identities. This disorder usually develops as a result of trauma or abuse, as a way to help protect the person from their trauma. These identities help them avoid having to re-experience their traumatic memories. Each identity that a person with dissociative identity disorder has is distinguished by unique characteristics. The average number of identities is 10, but can range greatly. Dissociative identity disorder is a rare disorder that affects around 1.5% of people in the world. Many people who have this disorder have been misdiagnosed in the past. They typically receive their dissociative identity disorder diagnosis after seeing several mental health professionals. Have you recently been diagnosed with dissociative identity disorder? Are you hoping to find treatment from a licensed clinical therapist? If so, we'll take a few moments together to learn more about dissociative identity disorder and what it encompasses. We'll also learn how licensed clinicians can benefit you. Here are some of the most common symptoms of dissociative identity disorder. Switching to separate identities. Most people who have dissociative identity disorder report having at least 2 identities. These identities can take on different characteristics, including unique names, voices, distinct personalities, and individual preferences. These separate identities may emerge during different emotional states. Next is feeling disoriented or disconnected from reality. It's very common for people with dissociative identity disorder to experience disorientation. Someone with dissociative identity disorder may report feeling separated from reality. They may also feel like the people around them aren't real. Some people start to feel disconnected from their own identity. Next is having memory loss. Someone with dissociative identity disorder may report having little to no memory from past events. They might not remember certain times during their life. Dissociative identity disorder clients can also find it hard to remember certain events, people, or even information about themselves. And next is suicidality or self-harm. People with dissociative identity disorder often report experiencing symptoms of suicidality. Some experience self-harming tendencies. Thoughts of suicidality or self-harm may be a result of poor coping skills or overwhelming feelings. There are a few causes of dissociative identity disorder as understood by experts. Each of these factors may increase the odds of developing dissociative identity disorder or cause it directly. The most common causes of dissociative identity disorder are as follows: physical abuse during childhood, sexual abuse during childhood, experiencing the effects of a natural disaster, or experiencing combat. So, what can a licensed clinical therapist do for someone who has dissociative identity disorder? Getting treatment for dissociative identity disorder is essential. Help from a licensed clinical therapist can improve a person's coping skills, reduce anxiety, and manage other symptoms. The most common form of treatment for someone with dissociative identity disorder is psychotherapy. Evidence-based interventions for trauma-related disorders, like eye movement desensitization and reprocessing, or EMDR therapy, and medications can also help. Our mission at Lightfully is to provide high-quality mental health care to various types of clients. We believe in using a focused approach using our precision care model. The framework of our clinic consists of evidence-based, clearly defined, data-driven, and whole person-centered care. We have experience working with various mental health disorders, including dissociative identity disorder. That's why we're confident that we can help you manage your mental health disorder symptoms over time. Lightfully offers multiple levels of care to both adults and teens: residential treatment, intensive outpatient programs, or IOP, and partial hospitalization programs, or PHP, which are known as our day treatment programs. We also offer virtual intensive outpatient programs for adults. We'll meet you where you are, and we'll create a personalized treatment plan designed to prevent crises. Change is possible. When you're ready to take the first step, reach out to our admissions team. We'll take the next steps together towards the fullest, brightest version of you.